Welcome to Wellness Wednesdays, a web series where we examine how COVID-19 has impacted our healthcare system and what you need to know as you re-engage with your physician and get the healthcare you and your family needs in 2022.
Today on Wellness Wednesday, I want to talk about cardiovascular health. I want to talk about ways to prevent having a heart attack. I want to talk about knowing your risk factors for having heart disease and how to prevent it. I also want to talk about re-engaging our healthcare system. So I think a lot of people were reluctant to get regular checkups because of fear of exposure to COVID. And thankfully now the numbers locally are low, and our healthcare settings are amongst the safest places that you can possibly be, because currently we remain masked in the healthcare settings. And it is safe now to see your healthcare provider. It is safe to get these assessments done. I think certainly there was a lot of reluctance if someone was well and not having any problems to avoid routine interactions with people for a long time. Also, I think that COVID impacted a lot of lifestyle. I think people during the course of the pandemic may have changed their exercise habits. I think that people probably are not eating as healthy as we would like. And so I want now that to encourage people to re-engage again in terms of exercise, in terms of healthy diet, and towards reducing your risk of having heart disease. The risk factors are actually similar for women as they are for men. The major differences in heart disease in men and women is that many women may not realize they're at risk. And women actually, heart disease is the #1 cause of death amongst women, just as it is amongst men. So I want to encourage the importance of getting screens for women, just as it is for men. I want people to know their numbers. I want people to know what your blood pressure is. And blood pressure is an important risk factor for heart disease that can be treated through lifestyle measures as well as medication if needed. I want people to know what their blood sugar is. Diabetes is a major cause of cardiovascular disease and other medical problems. Again, treatable through lifestyle measures or through medication. And I want people to know what their cholesterol is. The cholesterol and blood sugar is done through blood work, through lab work. The blood pressure check is done with a non-invasive cuff measurement that can all be done through your primary care provider. Yes, we have medications that can treat many of these conditions, but we would prefer to not have to use medication at all. If people exercise regularly, if they don't smoke, if they maintain normal body weight, eat a healthy diet, many people can avoid need for medication. And those healthy lifestyle measures can have a dramatic impact on your risk of having heart disease. Now, if you don't achieve targets with all of those measures, it doesn't mean that you're doing anything wrong. I mean, there are folks that have genetic conditions that need medical treatment, but we have a wonderful array of medical therapies that can help treat risk factors to lower your risk of heart disease. For further information, please visit our website, utmedicalcenter.org.